My name is Jasmine Jefferson, and I'm the Legislative Director at Social Security Works. Thank you for joining me to learn how you can speak about Social Security and Medicare to the media, your elected officials, and even your friends and family. Whether you've heard this presentation before or you just needed a refresher, we hope when you finish you are more confident talking about Social Security and Medicare than when you started. Let's start by highlighting two truths. One, the retirement crisis is real. And two, the healthcare crisis is real. More and more Americans are finding out too late that they cannot sufficiently save for their retirement on their own. 401ks are unreliable, and the 2008 stock market crash revealed the instability of the housing market. On top of that, prescription drug prices are too high, and we live in a country where people have to choose between paying for life-saving medical treatments and basic necessities like food and housing. Luckily, we have two systems that work really well to reduce poverty during retirement and a healthcare crisis: Social Security and Medicare. Over the past decade, conversations around Social Security and Medicare have changed drastically among experts and policymakers. At one time, it was considered common knowledge that Social Security and Medicare faced financial challenges that could only result in benefit cuts. In 2012, Social Security Works, along with several other groups, built a movement that pushed back against that notion. And today, most Democrats in Congress support expanding Social Security, and nearly half support Medicare for all. Also in 2012, Social Security Works sponsored research by communications experts Topos and KMP Communications. We were looking for a theme or idea to inspire people to join our movement and expand Social Security. Through this study, we confirmed that Americans love Social Security, and the same is true for Medicare. People, regardless of political affiliation, gender, or race, understand that Social Security and Medicare are important programs. What people lack is the confidence that these systems will be there for them. Americans lack confidence in Social Security and Medicare for so many reasons. We hear bad messages in the media, politicians, and even so-called experts show us graphs like these and make us think that spending on these programs is out of control. In reality, Social Security and Medicare are two of the most efficiently run government programs with incredibly low administrative costs. Spending on Social Security benefits is basically flat, and Medicare offers high-quality health insurance for millions of vulnerable Americans, but is taunted by bad actors like pharmaceutical corporations that prevent lower prescription drug prices and medical services. Expanding Social Security and Medicare will make these programs even more affordable and available for all Americans when they need it most. Now for the important part. You can't build people's confidence in Social Security and Medicare by refuting their arguments, but you can build confidence in Social Security and Medicare by telling your story and reinvigorating the images of Social Security and Medicare as the only systems we can truly count on. The first thing you can do is make Social Security and Medicare personal by adding the word "our." American workers have paid for and therefore earn Social Security and Medicare. Adding "our" reminds them of this simple fact. Next, we want to paint Social Security and Medicare as large and important by calling them systems. Altogether, you get "our Social Security system" or "our Medicare system." The next step is to help your audience understand the story of what we built, why we built it, and why now is the time to expand Social Security and Medicare. When we talk about what Social Security and Medicare are, we must frame them as concrete objects with an important purpose. Most Americans would never suggest we destroy or dismantle our national highway system or our currency system. Social Security and Medicare deserve the same respect, and we should not erode their protections or pull the systems apart brick by brick. There are many reasons why we built our Social Security and Medicare systems. One of the most important points is to highlight that they are both the most reliable systems that we have. Social Security and Medicare are more dependable than any private retirement plans or private health care insurance plans. Social Security has never missed a payment, and Medicare is providing health coverage for people who would never receive coverage in the private market. Lastly, we explain why now is the time to expand Social Security and have Medicare for all. Income inequality in the United States makes it impossible for anyone who is not extremely wealthy to depend on personal savings to retire and pay for health care. Wealthy Americans have seen very large income gains over the last decade. Now is the time for wealthy Americans to stop receiving lucrative tax breaks and pay the same rate as the rest of us. To summarize what we've learned, remember to say our Social Security and Medicare systems. Next, tell the story of what we built, an important and concrete system, why we built it, because we needed reliable retirement and health insurance systems, and why now is the time to expand them, because it's time for wealthy Americans to pay the same rate as the rest of us. Now that you've completed our training, there are many things you can do to get involved in conversations about Social Security and Medicare. You can tell your story to the media by blogging, placing an op-ed in your local paper, or writing a letter to the editor. We also encourage you to tell your story to your elected officials who have the power to pass legislation that would expand Social Security and provide Medicare for all. If you want to learn more about this training or get more information on Social Security Works, you can visit us online at socialsecurityworks.org. Thank you for joining us, and we look forward to hearing your stories.